Public health, not private wealth. Public health, not private wealth.
It's great to see so many of you here. Apparently it's about 400.
It was one of the finest spirits of this country, the creation of the NHS in 1948.
James Alexander.
Thank you. It's good to see so many people here today, and I wanted to give you a warm welcome from York. You're all very welcome over this very, very important issue. And this is an historic day, very historic. Today is the day when 13,000 people with income over £1 million will pay £1.3 billion less in tax. Average amount is £100,000 for each of those people earning over £1 million. While families, working families, are struggling. Now, I'm not against people earning a lot of money. Some of them work very hard for it. But I'm against the principle that some people are getting tax cuts from their very high earnings at a time when poor people are suffering. That is not the values that we have, and that shouldn't be the values of our government, but it is. They say that we're all in it together, and we're not all in it together, are we? People are being targeted, and they're being targeted in public services and within the NHS. There's a placard over there of Bevan. And Bevan will be turning in his grave if he could see what was happening today, and seeing those tax cuts, and seeing what's happening within the NHS. Cameron said he would reduce the deficit, but he wouldn't cut the NHS. But the deficit isn't going down, and public services within the NHS is going down. And successive governments have said it's about bringing choice to the NHS. Well, where is the choice when you end up with different areas having different amounts of money to be able to spend on health? The money should be based on need. That is what the NHS was founded on, and it's a national health service. And a national health service is being broken up. And that is not right at all. Why is it right, if we're all allegedly in it together, that the average spend on health in West Leicestershire will now be £956 per head, but in Knowsley it will be £1,691? That is not a national health service. That is not a national health service based on need. Why in York will the spend be £1,074 per head? York, and I know we have colleagues here and comrades from Bradford, are the hardest hit in the north of England in terms of funding for NHS services through the new clinical commissioning groups. And I've spoken to the leader of Bradford, and we are going to take part in a major campaign against that unfair allocation from this government. And I know a lot of people are saying it's wrong about the top-down reorganisation of the NHS, and they're right. The Conservative Party manifesto, and I know there's Conservative colleagues at the back who allegedly say that there are no need for food banks. These people did not say there would be any top-down reorganisation. The coalition document, the government's own programme for government, does not include a top-down reorganisation. It actually says there wouldn't be one. Yet they're spending £3 billion on that rather than putting that money into patient care. But I implore you to not attack the clinical commissioning groups who have had that responsibility placed in their hands, but on the government and those ministers who have made those decisions regardless. Now, where is the choice in public services when one clinical commissioning group area is going to be able to allocate certain health provision when another across a certain boundary doesn't? Where is the choice in that? It is forcing on places incredibly difficult decisions through the virtue of birth and where people live. And that is not right, and that is what should be happening. It is not, therefore, a national health service anymore. And I fear for a lot of the community-based services in North Yorkshire. I get a series of briefings regularly about what is happening with the finances. And I've said before that the Clinical Commissioning Group will have just over £1,000 to spend per head on health in York and the surrounding area. But that doesn't take into account the debt that is going to be taken on board from the Primary Care Trust, which will also be cut in services beyond that amount. And I spoke to government ministers about this, and they say, we will speak to my colleagues, blah, 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 and nothing ever happens. But the concern of it is, why is it right in London that that debt is written off, but not for North Yorkshire?
Yay!
Why should people in York be treated like second-class citizens by a second-rate government? It is not right at all. And the concern for those community-based services are areas such as the hospitals in Whitby, Selby, Skipton and Malton. They have a very difficult future, and under this government I don't think they have a future, and I'm being frank about that. And my colleague who's the leader of Richmondshire Council is very concerned about the Friarage Hospital in William Hague's own backyard, and William Hague is lobbying to save the hospital from his own government. And where is the mandate? Where is the mandate for this government to be able to bring in these changes? They didn't even win the general election. They didn't even win a majority. And the reason why there is this government is because the Liberal Democrats put them there in the first place. They didn't have to do that. And I call for a new general election and get rid of this government. Thank you.
Now, despite government claims that the Act puts GPs in control of local services, we know that GPs won't have the time or the expertise to handle the commissioning of local services, so by and large they'll be outsourcing the actual commissioning to private firms.
We cannot play politics with people's jobs, with people's services and with people's lives, because we will not let you and we will never let you.
Well, the NHS is not the same. What can you do? Go to your local health overview and scrutiny committee. They are run by the council and they meet every month. We've got a particularly good one here that's very supportive.
Representing is about making things better for patients. But you have to remember some of the other things.